Bryan Lung Cancer Center was developed because we felt there was a need to integrate care at Bryan. So what we do is we include pathologists, radiologists, oncologists, surgeons, and lung doctors all at the same table, all communicating and all talking about patients in a prospective fashion, because we know that patients get better results and have better outcomes if we do that. Lung cancer is the biggest cancer killer in the United States. It kills more patients every year than any other cancer. And a lot of times lung cancer has been pushed into the closet, and I like to call it the redheaded stepchild of cancers, because people are embarrassed to talk about it, and people don't want to give resources to it because they feel like people did it to themselves. Certainly a lot of it is caused by smoking, but a lot of it isn't as well. Up to 20% of lung cancers is caused by radon exposure and other environmental toxins, and then sometimes just a genetic predisposition. One of the biggest advances in lung cancer treatment has really been screening, and just recently we determined that it was actually effective, both cost-effective and had a survival advantage for patients to undergo lung cancer CT screening. Patients who are 55 and older who have a 30-pack year history of smoking are eligible for a non-contrasted lung cancer low-dose CT scan, and the earlier we catch it, just like any other cancer, the better chance of survival patients have. Lung cancer is variable in how we treat it. A lot of times a patient may be eligible for surgery, but many times patients will be deemed what we call non-operative, and they'll undergo chemotherapy or radiation therapy. It all depends on the patient. It depends on where the cancer is located and how advanced it is. Patients who have early stage lung cancers are oftentimes eligible for lung cancer surgery or resection. And the surgery of choice is taking out usually roughly half or a third of their lung on one side. We do it sometimes robotically, sometimes through a minimally invasive approach, and sometimes through a standard thoracotomy approach, which is the way they've been doing it for quite some time. We have such a fantastic team here at Bryan. It's really impressive, the people that we've put together on the Lung Cancer Center team. And it is critically important that all the team members communicate effectively in the care of the patient. Not just even doctors and nurses, there's other types of individuals who are involved in the lung cancer program as well.
As a nurse navigator, my main responsibilities really are to help guide a patient and their family through their personal journey with cancer. Oftentimes, this really may start even before they know for sure it's cancer. Sometimes it's the fact that they've had an abnormal scan, something unusual has been found, and I will get involved at that point, really to kind of help them know what are some of the things that we may be doing before. If it is cancer, what may be involved for treatment. Also what they can hope for or what they can expect following treatment as well. I believe it's important for people to know that they always have somebody that they can call, that it's somebody who cares and somebody who will be there. Because as I tell them, the calls don't stop and the questions don't stop after 5 and after Friday. One of the things that I'm the most proud about is our Lung Cancer Center. What we try to do is expedite the process of diagnosis, as well as initiating treatment discussions as far as what might be possible. What are the various options we have available? What are some of the unique tools that we have to help diagnose something that isn't available anywhere else here in Lincoln? And I think those things differentiate us.
Lung cancer is prioritized here. We take lung cancer and we move it to the top, and the lung cancer team is committed to that. People are passionate about it, people are excited about lung cancer care. You know, it's exciting to be able to offer patients the state-of-the-art treatments that we're able to here.